Good day everyone, I'm Christine May Hinabe, and for today's video, I will be obtaining vital signs. But first, let us know why is it important to obtain vital signs. Vital signs are useful in detecting or monitoring medical problems. Vital signs can be measured in a medical setting, at home, at the site of the medical emergency, or elsewhere. First, prior to performing the procedure, introduce self and verify client's identity using emergency protocol. Explain the procedure to the client and how he or she can participate in the assessment. Good day, ma'am. I am your student nurse, Christine, for today. And may I know your name, please? Junior Square. How old are you, ma'am? 11 years old. When is your birthday? June 11. Thank you, ma'am. Next, perform hand hygiene and observes appropriate infection prevention procedures and don gloves. I will be sanitizing my hands before proceeding the procedure. Next, provides for client's privacy. Is it okay to you, ma'am, if I close the door? The next step is position the client appropriately and inserting our rectal thermometer. But first, I will sanitize the thermometer. Ma'am, I will put the thermometer in your mouth. Can you please? Don't worry, ma'am. Your temperature is 35.4, which is the normal average. Next, wipe the tip of the thermometer with an alcohol swab in a firm twisting motion prior to placement. Next is the auxiliary method. Move gown sleeve away from arm and shoulder, rises arm away from torso, and inspect auxiliary area for lesions or perspiration. The next one is puts the axilla dry and places the tip of the thermometer in the center of the axilla and ask client to lay the arm over the tip and across his chest, turns the thermometer on. I will use again the thermometer. Now I will put this thermometer on my hand, in the armpit. Let's wait for it to. Next, wait for the appropriate amount of time. Placement. Electronic thermometer will indicate the reading is complete through a light or tone. Removes the thermometer and tell the client his temperature. While we are waiting, the client Okay, thank you, ma'am. Your temperature is 35.6. Next, wipe the tip of the thermometer, swab from stem to probe. Thermometer sensor in a firm twisting motion, removes and discards glove if applied. Perform hand hygiene. Okay. Next, let's proceed to the assessing of peripheral pulse. Perform the steps 1 to 3 of assessing the temperature. So let's start from the beginning. Good day, ma'am. I'm your student nurse for today. And may I know your name, please?
Junior school.
How old are you, ma'am?
19.
When is your birthday?
June.
Thank you, ma'am. Selects the pulse point. Normally, the radial pulse is taken unless it cannot be exposed of circulation to another body area is to be assessed. Okay, ma'am, please have a comfortable seat. Make your hands in this position. And next one is I will not use this thumb because the thumb has a pulse. That's why I will use the second and the third fingertip. I already access his pulse. Next, assessing the radial pulse in a supine position, and this is her position now, a supine position. Places the forearm across the chest at a 90-degree angle or places the client's arm alongside the body. Sitting in a sitting position, bend client's elbow to a 90-degree angle and support the lower arm on the chair's arm. Rest the table, extend or flex the wrist with the palm and hand facing downwards or inwards. Next, palpates and counts the pulse. Places first two fingertips, fingers over the groove of the thumb side of the client's inner wrist. So, as am I doing lately, I use my two fingertips because the thumb has a pulse and it cannot be done by it. Next, Counts for a full minute record the pulse in beat per minute on the worksheet.
Okay, ma'am. I will assist you. Okay, ma'am, you have 75 beats per minute.
The next one is assess the pulse and rhythm and volume. Documents the pulse rate, rhythm, and volume in the client's record, vital signs, and monitoring sheets. Also records in the nurse rows, pertinent protected data such as variation in pulse rate compound to normal for the client, and abnormal skin color and temperature. Okay, I will write your on the PTR sheet. The next is respiration. But before proceeding to respiration, I will perform the hand hygiene. And again, good day, ma'am. I'm your student nurse, Christine from Davao Doctors College. May I know your name, please?
Yes,
How old are you, ma'am?
19.
When is your birthday?
June.
Thank you. Next is observe a complete respiratory cycle of palpates and counts the respiratory rate. Counts the respiratory rate for 60 seconds. Observes the depth, rhythm, and character of respiration by watching the movement of the chest. Documents the respiratory rate, depth, rhythm, and character of the appropriate record. Diba?
How's your friend?
You have a normal rate. I will take this on your before. client has a normal rate because she has 16 beats per minute. That is a regular rhythm. Next is the blood pressure, or the I will be assessing the brachial artery. Ensure that the equipment is intact and functioning properly. Checks for cuff size and leaks in the tubing between the cuff and the sphygmomanometer. And in my case, I have my sphygmometer and the stethoscope. This one and this one are in a good condition. Next, make sure that the client has not smoked or ingested caffeine or has a dry strenuous activity within 30 minutes prior to measurement. I will ask my patient, ma'am, did you smoke?
No.
Did you drink alcohol?
No.
Thank you, ma'am. Next one is position the client appropriately. The adult client should be sitting unless otherwise specified. Both feet should be flat on the floor. The elbows should be slightly flexed with the palm of the hand facing up, the arm supported at heart level. Expose the upper arm. In your comfortable position now. Next, wraps the deflated cuff evenly around the upper arm and locates the brachial artery. Applies the center of the bladder directly over the artery. Mom, you have a 120 which is in a normal range. We'll take off the bone. The next one is position the stethoscope appropriately. Okay, I am finishing to take her blood pressure, and next is auscultates the client's blood pressure, and I already did it. So my client has a normal blood pressure between the 120 over 80, which is in the normal range. Next, removes the cuff from the client's arm, wipes the cuff with an approved disinfectant, documents and reports pertinent assessment data according to agency policy. Okay, I will take first this. I will write her TPR sheet. I will. And that's it. I already obtained the vital signs of my patient, and it says that her vital signs are all normal. That would be all. Thank you.